So who needs Adam's apple reduction? Well, I get both men and women come into my office all the time because the bump on their neck is too big. And for women, it's usually very thin women who anytime they move their neck, you can see a little bump there. Even though it's still a small bump, it can be a big deal to women. For men, it's usually, the bump is so big when they wear a collared shirt, it kind of rubs and it just doesn't feel right. I also get transgender patients who come in for Adam's apple reduction if they're transitioning from male to female. And so it's one of the more common procedures that I do. I do several a week, and it's a very safe and actually really satisfying procedure for me to do. So what is the procedure like? So it takes me about 30 minutes to do the procedure. However, it does take some time to put you to sleep and wake you back up. It does require general anesthesia for you to be completely asleep, and that's the safest way to do this procedure. Instead of a breathing tube that goes through the vocal cords, we use something called a laryngeal mask airway, and that allows kind of a balloon device to sit on top of your vocal cords and has a tube coming out of your mouth. The important thing about using an LMA, or laryngeal mask airway, is that in surgery I actually put a camera through that tube to get a bird's eye view of the vocal cords. Once I have the cartilage, which forms the Adam's apple, exposed, I actually look on a screen at your vocal cords and poke a needle through that cartilage and really mark exactly where the vocal cords attach. And in general, they attach about halfway up the cartilage, but not always, and we really want a safe procedure that preserves the voice. If you avulse that attachment at the front of the cartilage, you have a really deep, raspy voice, and it is almost impossible to completely fix. And so people that don't use a camera, that don't expose the vocal cords, I've seen come in my office all the time with permanent voice injury. I've never seen that in my office from a procedure that I've done, because I use this technique. It's the most important part. All this is done through a tiny 1 centimeter incision where the neck bends here. Afterwards, there's a little bit of swelling and bruising. However, I just use a glue to close the skin here so you don't have any stitches that need to come out. Once that swelling and bruising subside, you really see almost near immediate results right afterwards. It's really common to have some degree of hoarseness afterwards because the inside of your voice box will be a little swollen, and once that goes away, you have a normal voice. I even had a patient recently that had a speech that they had to do for class in college a few days later, but was totally fine. So it's a good procedure, and the recovery in the grand scheme of what I do is probably the easiest of any other procedure.